Hey, look, is that Charlie Sheen? Rumor is that you have hepatitis, and you are known for your lavish alcoholic ways.
Yeah, I like to drink. What's it to you, Tex? Anyways, where the heck is the party? This place is dead as my love life on house arrest.
All this partying can really get you into some trouble. Have you seen a doctor lately? You need to get a checkup before you infect the rest of the world.
Who needs a silly doctor? I am surrounded with goddesses. Speaking of my goddesses, where are those buxom beauties with my drinks?
Charlie, last night you were just complaining about your white stool clogging the toilet. Charlie, not only is it disgusting, it worries me at the same time.
Relax, Tex. You are way too worried about this. Remember those buxom ladies I told you about? Well, they bring me more white Russians than I can handle. So that explains the white stools. So leave me alone, Tex. You are always wrong.
I really hope you were not serious about that rational. Charlie, please explain to me about the fatigue you're always talking about. You can hardly get that drink to your mouth now.
Fatigue? Really? Is this what we are doing now? How could I not be fatigued? I drink all day every day. Maybe if I get some sleep and a little vitamin B, I'll be up chasing my goddesses again. Cha-ching.
What about you constant vomiting and nausea? You even have nausea when you were not spending your time drinking. Do you understand that I spent all day yesterday cleaning the bathroom floor? Charlie, I am not your mother. You need to get your life under control before you end up on house arrest again.
Tex, again, you are wrong. This seems to be becoming a bad pattern. Are you honestly trying to tell me that you have seen me without a drink in my hand? I do not know if you have heard of this concept, but apparently when you drink an excess amount of alcohol, you tend to vomit and become nauseous. I really do not see why you keep busting my chops about this. Look at me, I am perfectly healthy.
Okay, Charlie, this is my last effort. How can I convince you to go see your doctor? Look at your stomach, you clearly have abdominal swelling. Remember yesterday when I elbowed you to check out that hot blonde? You bent over in so much pain you missed her entirely. Your stomach is swollen, is so swollen. You are starting to look like those ladies on the third floor popping out babies. Please go to your doctor before you give birth to your pickled liver. Oh, and Charlie, thoughts not to 10, it's jaundice.
Tex, you are tripping. My stomach is fine. I might be gaining a little weight, but trust me, it is a gas tank for my love machine. And that is all. Why are you so worried about me? Do you not have your own life? I can send you a few of my girls. It might spice things up.
Charlie, you are ridiculous. I cannot believe how you justify your signs and symptoms of liver cancer. You even have edema in your extremities. I am pleading with you, please refer to your handout and notice that you have every sign and symptom of liver cancer. Let's review all of your symptoms. Nausea and vomiting, weakness, fatigue, enlarged liver, abdominal swelling, jaundice, and white chalky stools.
Okay, Tex. I guess I will see if I can stop my party for a day and see if I can manage to see a doctor or something. I really think you are full of crap, but I will do it just to shut you up. I cannot believe how dumb you are sometimes. Hello, my name is Charlie and my friend thinks I have a drinking problem. I personally do not think it is a problem. I enjoy every sip. Tex has nothing but nice things to say about you, but I do not understand why you brought me into this room. Do you not have a more professional setting?
Hello, Charlie. I have been expecting you. Tex has told me all about you and your partying.
Before we talk about me, Doc, I have to ask, why are you wearing a bloody apron and carrying a meat cleaver? To be honest, you are scaring me. Normal doctors do not look like meat butchers.
Charlie. Let's not waste your time and more importantly my time. Can you not see I have a patient I need to attend to as soon as possible?
Okay, Doc. You do not look like a man that I would want to make mad. Let's talk about why I'm here.
Yes, Charlie. Let us talk about you. Can you tell me why you are here today? Other than your friend Tex recommending you come here?
Well, apparently I am a walking example of every clinical manifestation of liver cancer that is possible. My stools are chalky white. I have jaundice, which I thought it was just a bad spray tan. My abdomen has been increasing in size, which some may call swelling. But most importantly to me, I have had a little nausea lately. And I must admit my occasional vomiting is not winning me any lady friends. Before we start talking, Doc, I need to tell you that it is going to be next to impossible for me to stop drinking. It just makes me feel so good and handsome.
Charlie, I am not here to judge your lavish lifestyle. I am here to educate you and tell you what your options may be. I hope you realize that you do need treatment. And you need it sooner than later.
Options? Treatment? What are you talking about? I am just here for a checkup and some information. Not for treatment. Check your chart and let's have a safety timeout because I think you got the wrong guy.
Yes, options. And yes, you need treatment. I hate to break it to you, but you do indeed have liver cancer. And if you do not act, it will kill you. Are you ready to talk about your treatment options?
Liver cancer? How did this happen to me? I did not even notice the warning signs. I am sorry, Doc, but I need to either sit down or have a drink. Preferably both. I cannot believe my luck. Why does this stuff always happen to me? First house arrest, and now liver cancer. I just want to be a normal guy.
Charlie, luck has nothing to do with liver cancer. Yes, some people are more prone to cancer than others. But your habitual drinking habits did not help your body defend your liver from cancer. Charlie, let me be honest with you. I am assuming by the smell of your breath and the stench of your clothing. You are drunk right now. Your liver is so large I am surprised that you are able to stand in upright direction.
I may be slightly buzzed, but I am hardly drunk. I am willing to listen to your treatment options. There are so many beautiful women in this world, it is not my time to leave just yet.
One of the options for treatment is surgery. The patient in front of us was diagnosed in the early stages of liver cancer. If your cancer is in an early enough stage, this too could be an option for you. I am no fortune teller, but something tells me that you are not in the early stages of liver cancer. So let's move on to other treatments, shall we?
I am a little relieved that surgery is not an option. By the looks of that meat cleaver in your hand, personally I have a safety concern. You look a little more than dangerous.
So you do not like knives? How do you feel about needles? Radiofrequency ablation is another treatment option for liver cancer. This treatment utilizes a small needle inserted into the core of the tumor. The needle will supply energy to heat and kill the tumor.
Needles are not a problem for me. Tell me more about injection options.
4 types of treatment are available in concern to needles and probes. One of the treatments we have already talked about. Cryoablation is another type of treatment that we offer. This is where a probe enters your liver and delivers liquid nitrogen which freezes and destroys the tissue around the probe.
Well, the freezing sounds interesting. Keep going, Doc. You said I have 2 more options for treatment.
If you would stop interrupting me, I could have told you about the other 2 options already. The third option is to inject ethanol or acetic acid into the tumor to kill the cells.
Acid? Are you kidding me? I am an alcoholic, not a junkie. You can keep your acid.
That is one simple mind you have, Charlie. You are just incredible. These are medications and medical procedures I am describing to you, not recreational street drugs. Anyways, before I was so rudely interrupted, the final type of injection is chemotherapy. These chemotherapy drugs are injected into the hepatic artery which supplies the liver cancer with blood.
Well, thanks for the information, Doc. I need to get going. I have a hot date tonight, so I must be off.
I was not done talking to you, Charlie. I have a few more options for you to consider. I still do not think that you understand the severity of your liver cancer. The 2 options remaining are a liver transplant and targeted drug therapy. I hope I do not have to explain what a liver transplant is to you.
No, Doc. I think I know what a liver transplant is. But why would someone want my liver?
God bless you, Charlie. You are a special man. A liver transplant consists of your cancer-infested liver going into a red garbage bag, and then a donor's liver taking its place inside your body.
Oh, well, that makes sense. What treatment are you recommending for me?
Well, first, Charlie, we have to determine which of the 4 types of cancers you have.
I thought you just told me that I have liver cancer. Now you're telling me that you do not know what type of cancer I have. Stop playing with my mind.
Allow me to elaborate. There are 4 types of liver cancer. Hepatocellular, which begins in the liver's main cells. The second type is cholangiocarcinoma, which begins in the liver's bile ducts. Angiosarcoma, which begins in the liver's blood vessels. And the fourth type is hepatoblastoma, which most frequently affects children less than 4.
Okay, well, are you going to tell me which type of liver cancer I have?
Well, assuming your liver cancer arises from your alcohol consumption, it is a safe bet that your cancer is hepatocellular.
Wow, this is just too much to take in. Here's my plan. I am going to go meet up with these girls I met the other night, have a few drinks, and then think about my treatment options. Do you think you could prescribe me something for my nausea?
Absolutely not. Why would I aid you in your alcoholism? You need some healthy natural sleep so you can consider your options in a clear state of mind. Please call me when you're ready.
Okay, Doc, I will consider your advice. But to be honest, I really like my plan better. I will be in touch. Hey, now that I think about it, you should come out with me tonight. Girls love surgeons.
Goodbye, Charlie. And good luck.
Well, Missy. What are you doing in that nurse outfit?
Oh, Charlie, this old thing. I had it laying around and I thought it would be funny. You know, going to see the doctor and all. I figured we could play dress up.
Oh, Missy, the tags are still on it. And the receipt is sticking out of your purse. But it looks good on you anyways.
Well, I try. Anyways. How did your appointment go? I am ready to party. Let's get some drinks. Is it time for a White Russian? Let me get you your drinks and we can talk all about your appointment while we dance the night away.
Oh my. This makes me so sad. I regret to inform you that you are going to be my only White Russian tonight.
What do you mean, Charlie? I came over and I am ready to party. Let's get it on. Let's dance, dance, dance. Shake it, Charlie.
Missy, stop. My health is not the best. I got some rather bad news today.
Your health? What do you mean? You look the same to me. And do not worry, they make pills for that problem.
Listen, Missy. I cannot have a drink. I need to fix some things with my health. Then we can continue the party. The sober way. Yahtzee and Diet Coke.
No party? Did the doctor check your blood pressure? You have gone crazy. How could have this happened? My life is over.
Relax, Missy. I am the one that is sick, not you. Do you remember my friend Tex? He decided to ruin my life and tell me that I might have liver cancer. Some friend he's...
Liver cancer? He cannot be right. That is absurd. How could that have possibly happened? Oh my God. You did not give liver cancer to me, did you?
No, sweetheart. Liver cancer is not a sexually transmitted disease. It is cancer. To put it in simple terms for you, it is a problem with my cells.
Well, that is a relief. The last thing I need is another sexually transmitted disease. How did you get liver cancer?
I am glad you asked. I have learned so much about liver cancer, it is depressing. One of the biggest things I learned is, apparently it is possible to drink too much alcohol. You know, they should print that on the bottle somewhere. A little clue about moderation would have been nice.
Charlie, I am scared. Should I get checked for liver cancer? I cannot die yet. I am too young, too pretty, too popular to die.
It does not hurt to get checked. Now that I have the disease. They told me that the risk factors for liver cancer are being male. Check. Hepatitis B. Check. And excessive alcohol consumption. Check.
Excessive alcohol consumption. Why does everyone try to ruin our fun? I thought we lived in America, home of the free. What is with all of these silly rules?
According to the CDC, 4 or more drinks per day is considered an excessive amount of alcohol.
Are you kidding? How am I supposed to keep hydrated? I can only have 4 drinks per day. This is dumb. I am moving to Canada. They love to drink.
Sweetie, I am talking about alcoholic drinks. You can still drink as much water as you want. Some even say that water is the key to life. It does not matter where you live, excessive alcohol consumption will always be bad for you.
Wow, I have learned so much about liver cancer. I am glad you were able to teach me. I guess you are good for something after all.
Well, Missy, I hope you have learned something today. Now that I am sober, I will be able to better manage my health. I wish someone could have provided me with a handout detailing all of the risk factors associated with liver cancer earlier in my life. Maybe now I would not be dealing with the consequences.